Hi, good afternoon. Welcome to our fiscal year 2018 Head Start and Early Head Start grant application process webinar. My name is Madeline Shea. I am a Chief Planning Analyst at DFSS, the Department of Family and Sport Services in the Grants Unit. Here with me today is Samantha Agner-Trawergy.
Excellent.
The Director of Early Education Policy with the City of Chicago. Glenn Lezon, the Director of Accounting in the Finance Division. Beth Stover, Assistant Director of Children's Services. And then we have Jackie Tiema, Director of Grants, and then Kiki Guan, what's your title?
The Supervisor of Accounting
Supervisor
here at
of
DFSS.
Accounting. Thank you. And then Ken McGee with
Claire
and
Victor Santiago, also with the Children's Services Department.
Great.
Thanks. So we expect this webinar to go about an hour and a half. And if you do have questions throughout, please hold them to the end. We've dedicated some time toward the end. So quickly, I'll do an overview of the webinar. On the next slide is our agenda. So first we'll have some opening comments from Sam about some upcoming changes in FY 2018. I will kind of give an overview of the application process this year, as it's a little bit different. And then we will go into great detail in the application instructions by section of the package. So section 1, Glenn will go through the budget and budget narrative in detail. Section 2, Beth will talk about the program narrative, including its 3 required attachments, as well as the action plan. And then section 3, I'll go over all the required signature attachments. We'll make a little bit of time for questions and make sure everybody knows who to contact moving forward. So first off, we have Sam talking about some changes in 2018.
Good afternoon. Thank you guys all for joining us, and for those of you who are on the phone with me this morning and get to be in a webinar, thank you for spending the day with us. I wanted to start with giving a little bit of context of what we were trying to do with the enrollment reduction and what the impact in the funding levels and the allocations that you got, and giving a little bit of guidance on how we're going to be implementing that over the next year. So as you write your grant and as you have the details of your grant, as you receive the detailed instructions of the grant submission this year, you also knew for your own planning what our intentions were. So I wanted to start with what were we doing? What happened this year? So we've been working with HHS for the last 9 months, as you know, since we did a conversion last year of taking some of our Head Start dollars and Head Start slots and converting them to early Head Start so we could serve more infants and toddlers. We still were finding and are finding that our cost per child for Head Start was still some of the lowest in the country, and so really needing to address that, and in doing so had decided on the course of action, as we talked to you about last couple of months ago at the EDPD meeting, of doing an enrollment reduction. So we have proposed to HHS that we take 4,000 Head Start slots this fall in this year's application and convert those to more dollars that can serve a fewer amount of children at a higher rate. The reason for doing this was multifold. One, as we've been talking about over the last 18 months, is that we in order to serve and meet families' needs with Head Start dollars, we knew that many of you were braiding those with other dollars. With the volatility of the state child care eligibility over the last couple years, we know that many of you were not able to stay fully enrolled, and we needed to make some adjustments on the system side to support you in doing that. In addition, we needed from HHS, we're coming up in the fact that we were going to, if we could not get fully enrolled and make sure that we were fully enrolled by September, we were going to have to make some tough choices about keeping our grant. So we decided to propose it this way. This also helps us with two other objectives. In addition to grappling with the under-enrollment, it helps us with the cost per child, as I mentioned. It allows us to redistribute the funding that had been distributed for 4,000 additional slots to our agencies that will increase our cost per child to a rate that is more adequately funding a full day program. It also allows us, leading to the third objective, to differentiate our costs between full day, half day, home-based family child care homes, and more adequately fund what people were needing to serve our most vulnerable children in Chicago with a full day of programming, and be less dependent on child care eligibility as a mechanism to do so. With a lot of the shifting priorities, policies, and funding structures in the state and the federal government, that we were needing to make some tough decisions. I want to start with the fact that in an ideal world, if we could have continued to serve the same 4,000 children and achieve the other objectives, we would have. But that wasn't the case we're in, and so we are in a position where we're having to make some tough decisions about distributing it and making sure that we can keep high quality services available to our families across the city, while also addressing our under enrollment, addressing our low cost per child for Head Start, and addressing the true cost of full day as compared to half day. So those are some of the reasons we have made this proposal. And now I want to talk a little bit about how we are actually implementing that proposal and the analysis we did. And then you'll hear from the team as we go forward more details about how you can be in dialogue with us around what it is you're hoping to achieve as well. We did look at community need, and we looked at available quality metrics that we had, and made some tough decisions and some tough suggestions. There are a couple of things that I think are pertinent here. Is that we were very, very intentional and very, very purposeful to make sure that while agencies may have seen reductions in slots, aside from a couple unique situations, everyone remained whole funding-wise, or saw a slight increase in their funding. So that's very important, because the way we are implementing it, the way we are suggesting, while there will be places, if you have a number of partner sites where you may have to make some tough choices about partners, what we are trying to do is make it so that every single child in a Head Start funded classroom does not have to be Head Start eligible. So that if you have traditionally had 40 slots, and we looked and saw you were traditionally only enrolling 30 Head Start eligible children at the beginning of the year, that didn't mean you should eliminate the capacity for 10 children. You should still keep that capacity, but you now have more funding available and less of an enrollment expectation that not all 40 of those slots have to meet Head Start eligibility. That is a critical component. We don't want you to pull back on the capacity you have been providing. Your dollars have not been cut, so you should not pull back classrooms, close classrooms. There are going to be some decisions around partner sites, keeping partner sites, and we do want you to think constructively and be in dialogue with us around how you're going to do that. So the I wanted to stress that point because we've gotten a lot of feedback that people are seeing, I got a reduction in slots, therefore I have to, in my direct operated sites, have to close classrooms. And no one did receive except the very few situations that were unique, no one saw funding cut. So you should not have to close classrooms just because of funding. That said, we know that those of you that have many partners, this has been an issue, and you have, in order to keep full enrollment, have been seeking partners and had to make some compromises for yourself too. We're encouraging you now to do that self-analysis, to look at what, how you would like this distributed, where the choices you will make, and respond back to us with how you would like those slots distributed. That said, we did make a suggestion, but it's a dialogue. So we made a suggestion knowing that we don't know your relationship with partners. We don't know who, you know better than we do, who's made improvements over the last 2 years and what that improvement has looked like and what change they're undergoing, and the community, the outreach efforts they have to serve the most vulnerable population in the community. So really to pay attention to all of the factors that we may not have a lens into and propose back to us how you would like that distributed. Another key component here is what you should be doing in terms of enrollment. We are not, while this grant goes into effect December 1st, we have been working with the feds to let them know we won't be enrolling to our full current number September 1st, just to know that we're going to have to reduce capacity on December 1st. And so we do not want you to kick any children out. You should not feel like you have to go and recruit up to your current allocation if it's been reduced. You should be planning for September as if it was at your December levels. And we are negotiating with HHS to make sure that no one is penalized for that. So those are the big things we wanted to address here and let you know of how we were playing it out. I think those are the big points. Anything else there?
I think the rest of it will happen when we go through the grant application.
Great.
And
great. So a couple other than bigger notes on that part is, as you know, we were thinking about another conversion. We would like to convert further slots to infant toddler. Given the huge undertaking it is for us to come and do this enrollment reduction with you, we will not be pursuing that for the fall. So at this time, there are no additional early Head Start slots. That said, please log your request into the survey link that was sent out both from CPP before they shut off their lights and from our team from CSD. We can resend it if you need it. Log your request there. We will be, if you are asking for more slots, more preschool or infant toddler slots, first, that will be what we're using to do some of our future planning on this. So please make sure it's recorded in there. And second, for those of you who joined us this morning, as I said this morning, be prepared with the request and your numbers and how it breaks down. As you know, the consolidation and what we're trying to achieve here is a better comprehensive lens on how we can support you. So rather than asking for 10 slots to make up a classroom, given the fact that you didn't receive a funding cut, what we need to know is, are you asking for 10 more slots? Or are you asking for additional funding to support the classroom? Are you asking for, is it because you have Head Start eligible children who need Head Start eligible services that are above and beyond what you have funding for? Or are you looking to keep a classroom whole? And we can look across our funding streams to help support you. So I say that because you're going to get the details on how to plan for the slot allocation you have. If there's a request that you have, please log it and be prepared to go over with us the numbers and the funding distribution so we can constructively help look across our resources to work with you. We won't be then necessarily funding the slots the way we had been before of you get 10 more slots. And So be prepared to really do your own analysis and not be dependent on us to do that as you ask for additional requests. And that will be the information that we're using to plan for further conversions in the future. We hope to start planning for that after we implement the reduction, and as well as additional state funding that we are receiving from the Early Childhood Block Grant increase. So if you have any questions about that, we went into much further detail in the webinar this morning, and so you can have that as a resource. In addition, I know many of you are probably wondering around the policies, the consolidation implementation. We did also spend some time on that at the webinar this morning. So if there are any questions on that, I don't want to waste the time for those of you who sat through that. Feel free to watch that webinar and reach out with any questions around that. I also just want to end by thanking you all very much for being patient with our condensed timeline. You know, with the consolidation, all that's going on, with the COLA request that all of you were so responsive to us as we were rushing through that. You're looking at our team, or if you were around the room, you're looking at our team. We're a small team working, you know, very diligently on this. So appreciate your patience with the condensed timeline and your willingness to really to be responsive and to think with us, and to make sure that we are submitting to HHS what we need to submit to HHS to make sure that we can continue to work with you to serve the children and families that you serve. So before we go on, Victor, are there any questions that are specifically relevant to the part, so I can step out and other people can?
Yeah, we got a few.
Okay.
Will you be setting up individual meetings with agencies to discuss allocations?
We are having individual phone calls with agencies right now, so we're in the process of making phone calls and talking through that. If there's a specific question you have, a follow-up from our phone calls, if there's a specific question you have around your slot allocation, please bring it up on the phone call. Otherwise, I'm not quite sure if this means in specific to partner agencies, or what it looks like in director operated sites if you need to let go of a partner. The first step there, which I think Beth will talk about in a little while, is for you to propose to us in writing what your requested allocation and distribution of your slots would be. Then we would either be able to approve if there's no issue, or set up the one-on-one conversation from there.
If we are to enroll based on December 1 allocations for the program year beginning September, but will continue to receive current funding rates until December 1st, is that correct? That we will serve fewer children at a lower rate for a quarter of the year?
No. You all got your release now, so it's based on your current enrollment, and that goes through December. Mm-hmm. I'm looking at Keith. Into November, I'm sorry, yeah, so until November 30th. So your dollars, your budget that is, I'm looking at Keith, you can correct me when I mess this up. The dollars that you got in your budget, once approved in your budget revision, are yours to spend. The dollar that your enrollment expectation will be your December 1st level. We don't want you to enroll children September 1st just to have to kick them out December 1st. So be cognizant of that as you go into September 1st. The budget you have now with the budget revision is the budget you have through November 30th.
When will we receive the revised allocation?
You should have all received the revised allocations this week, Tuesday, for Head Start, Early Head Start. You should have received your budget release package for FY17 last week. Right, so that was sent out Thursday or Friday last week. Thursday or Friday last week, depending on agencies. Your FY18 allocation should have been received Tuesday
afternoon.
So this,
Why you know about this?
this webinar is in response to that allocation.
Please confirm if we can still blend funding between early Head Start,
Yes,
PI, and Head Start and PFA.
absolutely. You can still braid funding between early Head Start PI and Head Start PFA. If you're wondering about how to code that, that code is that there's a COPA webinar that was done on that, so you can reference that. But you can still continue to do that, and we anticipate that. We also know that if you were braiding Preschool for All and Head Start dollars together at current rates, you still weren't making close to a national average of affording quality in the classroom. And so that is why this enrollment reduction allows us to, if you are braiding those funding together, get you closer to the cost for that quality expectation.
Okay.
Okay.
Okay. Thank you all so much. I'm going to step out and you're going to get a lot more information. So thank you all for joining us, and I look forward to being in touch.
Okay, so back to the grant application process. Again, I'm just going to kind of introduce it because I know, as I'm sure you probably know by now, it looks a little bit different this year. And though there is a lengthy instruction manual, these materials have been designed to make the grant guidance clearer. By now, you should have had the email containing your funding letter and the grant application guidance. This email is, as we mentioned, sent out on Tuesday afternoon. With that email, you should have a total of 7 attachments. Those attachments are the funding letter, which is specific to your agency's allocation, the grant application instructions, Appendix 1, which contains a large part of the attachments. There were 3 Excel files that were emailed separately. These are also required attachments. Attachment A contains your budget and budget narrative, which Glenn will go into detail. It's definitely a little bit different. Attachment B2 is a program narrative attachment. It's the proposed site allocation, which is also specific to your agency's sites. Attachment B3 is also an Excel file, and it's your program schedule, also part of the program narrative section. And then finally, Appendix 2, which is just, it's not necessarily required, but it's a quality control checklist to make sure that what you're submitting is complete and what we expect to be in the full package. So in order to get the most out of this webinar, it would be great if you had all of these materials in front of you as we go through. And because of the shortened turnaround for completing the FY18 grant application, we've split the full package up into 3 sections that have distinct due dates. And the next slide has the full timeline. So as you'll see here, the first due date is Friday, August 4th, and that's when you'll submit your draft budget and budget narrative. We'll talk more about this in just a second. The second deadline is Friday, August 11th, and that will be all of your program narrative items, as well as your action plan. And then the last deadline is Wednesday, August 23rd. And that is the deadline for all of your required signature documents. And again, these need to be submitted as a hard copy. And the staggering of the components of the grant application, again, is really designed to assist in managing the flow of you developing your application, DFSS reviewing and approving it, and DFSS compiling everything as a complete, accurate package on time for September 1st. submission. So first, I will hand it over to Glenn to discuss the budget and budget narrative in detail.
Okay, thank you, Madeline. So Victor, if you'll go to the budget, please, the separate schedule. Thank you. So as Madeline mentioned, we're taking a little bit different approach this year. Hopefully that we've streamlined things to make it easier for the flow of the documents for you, rather than having a series of individual documents, combination of things. We've tried to pull it all together in separate sections to walk you through all of your needed forms, but then again, of course, there's those separate ones that have to be completed independently. Taking a look at this schedule that's up here right now, this was one of the Excel attachments in the funding letters that we sent out on Tuesday. And by the way, if anyone at all didn't receive this funding letter, and that could be remotely possible because you'd be aware of this webinar through CSD's communications, asking you to sign up for it, but it may have gone to possibly either an executive director or someone administratively responsible in your organization that maybe didn't get passed down to the numbers department folks. For whatever reason, please reach out to any one of us here on the team and we'll make sure that we get that email out to you directly. But looking at this, this is the cover page. Again, a form that's not unfamiliar to everyone, asking for the demographic information, leadership, things like that, and some of the bits of information that you choose. In this case, Head Start or Early Head Start will drive populating the names in the succeeding sheets. So Victor, if you just scroll down on this one just a little bit, please. Again, this presents a checklist of information there. Complete the checklist and the attachments. Again, you're seeing a lot of the same things over again. You'll see it in these slides. You'll see it in the attachments that we've provided for you. But again, it's an attempt to be as all-inclusive as possible in every setting so that nothing slips through the cracks and that we don't have to reach out to you at the back end, but that through the process, you're gathering these things right away up front and getting ready for the submission. Victor, if you'll go to the next tab on there that says Personnel. Again, the Personnel budget form is very similar to what you've been used to dealing with now. It's an Excel-based sheet, so completion on there will just be a matter of putting the numbers in there. If you have individual issues and circumstances, again, as you've come to know that you need certain customization that isn't possible on there, reach out to anyone in the finance team, and then we'll be able to make the amendments that you need for your budget schedule. Also, Ken McGee is with us here from Claridyne, as we introduced at the beginning, and they also can work with you on that too to make any needed changes. Victor, if you'll scroll down just to the bottom of that, again, it groups by the 4 separate personnel categories that you're familiar with. If we go to the next tab, Fringes and Non-Personnel, again, listing out fringe benefits, other operating expenses, contractual expenses, and so forth. The good thing, and I'm going to jump ahead for 1 second, if, Victor, you'll go ahead a few tabs to budget narrative. What's unique this year, and it's the first time we've done this, and we hope that this is very beneficial for you, is that all of the numbers that you enter on the personnel and the fringes and the non-personnel worksheet will flow directly to these charts, that the tables that are integral within this narrative. Last year, we provided a different example, a word narrative for your budget narrative, but we would like you to use this exclusively. Please don't use a format that you may have provided last year, but use this again because the numbers will populate in all of those tables for everything that you include on the personnel and the fringes and the non-personnel section will flow automatically through there, so that if you make a change, though, another point I want to make is that if you make a change, please don't make it to the budget narrative schedule. If you have a dollar change for whatever reason, make it on your personnel tab or the fringes tab, because then it'll flow to this schedule. If you do it here, it'll corrupt it. So that is something to please be very careful on. The other text sections in here where it calls for delegate agency name, summary dollar amounts, and detailed explanations, that's the place where, as you've done in the past, include your detailed explanation to best fit the situation and whatever the particulars are. One of the reasons, again, that we've designed this format is this helps when HHS reviews the submission for all of our agencies. We found that the questions that have been asked of us afterwards are along the lines of being able to align dollars that are in their budget versus dollars that are in the narrative, and visually, it's a very visual thing that they like to see. This way, it'll be aligned between the two documents, hopefully, and that it can prevent a lot of questions on the back end where we're having to reach out to you for changes, things like that that need to be done, which all is very time consuming. We want to make our initial submission hopefully as seamless as possible. Victor, if you go back to the one then after fringes, if we could just go back to the one that says SF 424A, that tab. Again, this is linked to the other worksheets. Completing the information on there will populate the 424A with the appropriate numbers in the appropriate categories. And we'll go to the next one, Victor, the SF 424. Again, the sign-off sheet that you're familiar with. By choosing Head Start or Early Head Start on the cover page, that will populate the section above here to denote which of the two that they are. And along the same thing too, that this will call for the entering in on federal and non-federal. That will come off your funding worksheet that you received on Tuesday of this week. Again, this form is very familiar to everyone. And at the bottom of it, it calls for the signature from your chairs. The next schedule, Victor, next to that is other sources of funds. Again, another Excel-based worksheet, and that's fairly self-explanatory for what it's asking for. I'll save a few comments for when we later go into the instructions that we've provided, but again, this is fairly self-explanatory. The next tab is budget narrative. If we can go back to that. Again, this is the same one we were just on a few minutes ago. It's lengthy and appropriately so, covering all the 14 bases that need to be covered for each of the various categories there as applicable for your individual agencies. And less is not necessarily more in this case. The more information, the better. As your budgets are being reviewed, it will provide better information up front for our reviewers. If you have a unique circumstance, don't make it short and sweet. Let it be longer, and we can edit it as appropriate during the review process. But this way, you can maybe minimize questions when we're reviewing things independently without having to contact you either through phone or via email. The next one, instructions for a narrative. Again, this is a walkthrough of the various tabs we've just gone through right now. Very similar things that people have seen before. Yes, thank you. Thanks, Key. And Key mentioned that this summarizes the 14 points. So that's it on this Excel-based document here. We can turn that one off, Victor, for a moment. Then we also have the instruction. That is a PDF schedule. It should be in there
Yeah, that one.
Yeah. And that's coming up right now. We have a nice, long, hopefully very straightforward document for everyone to follow. There's a lot in here. Granted, as we can see how many pages there are, but we're hoping that it's organized, as Madeline had said, in various sections, very cohesively to be able to flow the information that's needed from a budget standpoint, from a program standpoint, as well as for all the supplemental documents that are needed, either signatures or certifications. So this table of contents lists the sections where it's discussed in the various pages. And as we scroll through, it again provides an overview, an introduction there, recapping the timelines here that Madeline had discussed a little bit earlier, and the various contacts, discussing the attachments, and as we scroll through the detail of behind the scenes of doing the schedules and comments, things along those lines. One of the things we've tried to be sure that we enhanced in our instructions this year are to minimize review points that came up in prior reviews, be it either of the partnership for those that are have that grant funding, or for the Head Start base grant itself, where HHS has reviewed and come up with a lot of questions. A focus has been on non-federal share. That's been zeroed in on a lot in terms of the sources of the fundings, and I know that this isn't what we're looking at here right now, but it's part of our narrative where we want to emphasize the fact, please be as detailed as possible when you're completing that section as to the dollar amount, the source, how it's derived, and just as much as, Ken was going to say?
And the valuation.
And the evaluation of the numbers behind that and how they're arrived at. Very important factor. It's not to say that there won't be another area that's being zeroed in on when this is reviewed, but this is one of the things that we've encountered most recently through the review of COLA and then through the review of partnership also too. Again, summarizing the timetable right there. And Victor, if you just want to scroll through. Oh, Beth,
you want to go back?
Too.
No,
Yeah.
Go back to section 1, Victor, since we haven't hit section 2 yet. There. Yeah. So where you want?
No, we're good. We're good right there.
Yep.
So back at attachment A, the budget, we just walked through the cover page, personnel, fringes, the 424A and the 424, and other sources of funding. So again, as we've mentioned, the Claridine group is here with us, and they will be reviewing the draft budgets. We ask that they all be submitted by August 4th, which is next week, Friday. As Sam had mentioned earlier, we're under a very tight time frame, tight turnaround. We recognize this, and we do appreciate your cooperation as well as starting this as soon as possible, because there may be just a lot of questions that may come out of the material. So the sooner the better in that case. Victor, if you'll scroll down just a little bit more, please. Attachment A, the budget narrative. Again, we've talked about those, and as Key mentioned about the 14 items that follow in there, each one of them being delineated here with comments as to how to approach them. We don't need to read through each one of them individually, but please do pay attention to them and see there's a reason that they're there. So if they're there in the print, there's a reason for it, to try to minimize review points on the back end. And we'll just continue to scroll through all of those that either are applicable or not applicable, as the case may be. And again, if we stop right there for one section, Victor, going up, just again, if there's questions, again, summarizing the fact that please refer your questions in the preparation of it to the our outside reviewers, who have the email address right there, grantamp2018@claridine.com. And also, please copy us here at DFSS. We have the separate email address set up there, hsehsgrant@cityofchicago.org, so that we're on the same page with anything that's being discussed.
We have a couple questions.
Okay, go ahead.
Where will these documents be? I think, does she mean the email that went out?
Right, so all of these documents were emailed on Tuesday to the point of contact. We have the executive director and or program director. So you should,
Hopefully have received them.
right, and if you haven't, then you should send an email individually to Glenn.
Sure, send it to me.
And maybe CC, Madeline, Shay, and Victor. All of our contact information will be at the end.
And please do it right away.
Yeah.
If you haven't, if these documents are unfamiliar to you, please email us right away.
Is there any way we can get more time?
No.
I guess.
And there's the answer.
That's the answer.
The answer is no. These time frames are absolute.
Okay, that was Mark Kinzer's question. Thank you.
So let me just say, number 12, special situation conversion. Do you see that on the application? That was a misstatement from last year. Just, again, say not applicable, all right? Because we're not doing the conversion this year. We'll be doing a conversion next year. All right.
Okay, do we want to go back to the slide?
Sure. You want to go back to the slide? You want to put me on camera again? Hello, everyone. Good afternoon. We're ready for the exciting program narrative portion of the training today. Okay, Victor, now you can go back. Next.
There's the due date again.
All right. Program narrative. Go back one, Victor. So I'm going to cover the attachment B, which includes the program narrative. So there's all the program related information. The program narrative, your proposed site allocation, and your program schedule, and then we'll just give you some reminders about the action plan. All right. So the program narrative. Next, Victor. Thanks. So follow the detailed instructions in the grant application instructions. All right. Develop and submit in Word. This is real important. Sometimes what we do is we condense things and the like, and it's much easier to manipulate if you send us a Word document. We won't say anything bad about you. Don't worry. So it doesn't have to be a PDF. Do not send a PDF. Send a Word doc. The important thing to understand too, as you know, like as the feds move towards their new monitoring system, as they move towards the new performance standards, this document, the grant documents, are going to be what's used to do federal monitoring. So what you include in your program narrative ends up being pretty important because they'll have access to those documents, and when they come and see us, which someday, presumably they will do, even though we've had our guardian angel looking out for us, and we haven't seen them, and except for the class, which went smashingly. So it's important that you provide us with a well thought out program narrative. So I also wanted to say that for those of you who have done the Early Head Start Child Care Partnership application, the instructions should look familiar. Hopefully, in many of these cases, you're just going to be able to take the information that you provided then, update it, and include it in this narrative. Obviously, if you're talking about Head Start, there's some changes that happen or Early Head Start, since they're different programs than the Head Start and the Early Head Start, but some of the things will be easily transferable, and you'll be familiar with them. All right, slide 2, go ahead. So the first section that needs to be completed is the program goals. You need to provide progress and updates on the goals and objectives. you should integrate into those goals and objectives any priorities that were discussed in your roundtables. They should align with the action plan. So you want this alignment from the roundtable discussion to your program goals and objectives to the action plan, right? We've provided table 1 for you to fill out, and any additional comments you can include in the prose narrative of that section. Follow the instructions in the under section A. Next slide. And that's what the table looks like, right? So, like I said, Early Head Start Child Care Partnership, you can just give us the progress update, any changes. If there are additional lines needed to that table, add them. It's in Word, and make sure it aligns with the action plan. Next slide. Section B, service delivery, enrollment reduction. All right. So B1 asks you about your communities that you serve, and to summarize the findings from, summarize the findings from your community assessment. That must have gotten cut off. So just a brief paragraph under B1. Again, read the instructions for details. I'm just giving a quick snapshot of what the question is asking you. But you can pull stuff from your community assessment. It doesn't have to be extensive. It doesn't have to go on for pages and pages. A paragraph or 2 is sufficient. Okay, next slide. So then in section B, B2, it refers you to this B2 attachment. And this is the allocation by site. This is information that the feds have asked us for. They asked us for this for the conversion, and we put it together, and they're going to ask us, I think, as we move forward. So what we did, and I think that Sam mentioned this, is that we made a proposal based on the information we had, DFSS notes. Do you see that? It's almost in the middle of the page underneath the pink hand. What we knew about that area. So here's a sample for the Community Whaling Delegate Agency. And you can see that they have 5 sites, right, in 5 community areas. We provided some information here about what our community assessment said about those community areas. Also, we have a need map that takes each census tract and assigns it a need level based on several factors that are listed out in the grant application instructions, poverty rates, poverty percentages, intensity of poverty, violence, and children born to teenaged women. And it assigns it either greatest need, significant need, moderate need, fair need, or least need, all right? That doesn't mean that least need doesn't mean that there is not any need, but it's not as great as these other areas. So we listed that need area for the census tract each was in, right? Then whether it was a directly operated or partner agency, and then what we proposed. And you see that the first purpley blue column is for center-based and family childcare home full days slots, and the second column is for half-day or home-based slots. That's our proposal based on the information we have. Now, as Sam said, you know your sites much better than we do. So what we're asking you to do is to provide us with your allocation, provide us some data about the area that site is serving, and then provide us a justification, especially if it differs from what we did, right? And that's all, just a line or 2 so we can provide that information to the feds. We're not looking to tell you where to put your slots, but we do need to have some sort of justification for where the slots are put, right? So the exciting innovation that we have for this year, next slide, Victor, is the Community Needs Assessment tool that perhaps you remember from the Ready to Learn RFP is retooled and back online. So I was hoping that we could really quickly go onto the internet and look at that tool.
Yeah, we can.
Can we do that?
Where am I going?
So first, take us to the Children's Services Division page. And the instructions for this are in your application. You can go to the Children's Services Division page. You can go to Providers and the PDM page, Content Area, PDM. Scroll down. Oh, there we go. A little bit further up. So Program Design and Management, DFSS, Community Assessment, and Early Childhood Program Resources. You know, here are all of our community assessment-based resources for you, including the Chapin Hall websites by community area, Young Children in Chicago, Early Childhood Care Program Supply and Demand. Scroll down. There's the community assessment, the long community assessment from 2015. There's a community assessment brief that we prepared for this year. I believe that CSD Update sent it out earlier in the year, but you can always go and look at it here if you didn't get word of these documents. And then we have the Chicago Community Needs Assessment Tool. So let's click on that link there, Victor.
I'll send the link to this to everybody.
Okay. So
Which one?
see that Community Needs Assessment Summary Tool. Yeah. Dun, 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 dun. So here we have this really fun tool that you can use. There are a lot of instructions on the tool. There's a video that you can watch, CNET video walkthrough. We're not going to go over that now. But I want to show you really quickly how it works. If you can go onto the map of Chicago, Victor. Let's make it a little bit larger or smaller. I don't know, you know, zoom in, I guess is the word. Maybe come to where we are. Where is the, there we are by Eckerd Park. A little bit further north. There we are, Eckerd Park. So we take this little sheep down here in the lower right-hand corner, click it, and then we're going to outline our service area. So our site, as you all know, is right there on Chicago Avenue and Ashland. So let's say, put it where my finger is, right here on Western, Victor. Click to right here where my finger is. Do you see my finger? Oh, he's putting on his glasses, everyone. Yeah, that's fine. All right, click. Up here. Now drag, I clicked and I drag, click. I drag, click. I drag, let's say I come all the way over here. From here. Okay, now I'm going to hit run, the green run. So here I can find for this area from which where I recruit my children from, I can find all kinds of data specifically targeting this area. So go ahead and scroll down. I can find out about the children under age 5 who are living in the area. You can keep scrolling down. I can find scroll down to this question, about the workforce in the area and the parents who work. And since it's green, it means that this is a pretty reliable number, right? Whereas my red, maybe not as reliable. As you can see, there's a larger, you can't really see where my finger is, but if you go all the way over, you can see how big the margin of error there is. Just try to remember your statistics 101 class, right? And then I can find also some things about other things like the violent crimes in the neighborhood, the Chicago Public School information, births to teen moms, renters, things like that. High school or the education level of adults in the neighborhood and the like. So you can run as many of these as you want, right? So for any site, just like we did when we did the RSP, go ahead and run a geographic shape, and you can use that information. So everybody has the link now. Victor has sent it to you. So if we can go back to the PowerPoint, you're going to send them that too. Great. Great. What I can do then is, if you look carefully, there's a couple columns that says CNET, number of children ages 0 to 5 under 100% FPL, CNET, number of children ages 0 to 5 under 50% FPL, CNET, number of children ages 0 to 5 childcare eligible, and other CNET indicators. For each site, right, please fill out for their recruitment area that information. And then you can add a CNET indicator that you think might be particularly relevant for those sites, relevant for the work you do, or if you're using an additional indicator to make a justification for allocating to that site. Okay. All right, next. So in the last part of section B is the, if you can provide us a map of the service area. It doesn't have to be high tech. One thing that I think we'll work on in the future with that CNAD tool is getting print-outable versions of the map, but you can just copy off Xerox, I almost said, yeah, copy off a map of the city, draw your service areas around your sites, and send it in. That would be great. So we can include that. So next, Victor. So I feel like I want to get through this pretty quickly so there are time for questions and the like. This is the rest of the program narrative. Mostly section C through K deals with your service delivery. You can revise this information from your agency's approved fiscal year 17 grant for Early Head Start Child Care Partnership. Obviously, you have to make adjustments for the program model. You should use information from your management plans and your policies and procedures, cut and paste it in, just make sure it flows. You all know I'm a former English teacher, so please make sure it flows. And write in complete sentences. That's my English teacher comment. Most of the other stuff is pretty self-explanatory, pretty brief. A sentence or two will cover it. Please, you don't have to go on for paragraphs and paragraphs. Mostly it's about providing us dates, providing us a copy of your current selection criteria on your RCIA. Attendance, ask you to provide us some information about your attendance over the past year. Health, ask you to list out the screenings you use, ask you to list out your health collaborations, ask you to list out your mental health consultants. Next page. The education services, that's a little bit longer. They want to know about your curricula. They want to know about your strategies to improve teaching. And there, if something's going on and we have a low class score for a site, either A, you might disagree with that and you might have better updated class scores. Great. But we're also not saying, oh, just because they have a low class score that you should, that you can't use those classrooms and those teachers. Just provide us in those cases information about how those teachers are going to be supported. What kind of coaching, what kind of mentoring, what kind of strategies will be used to improve teaching. Number 4 is a chart about credentials. Number 5, this is about ensuring that there is staff available to cover breaks and lunches and the like. 8 and 9 deal with disabilities, your services for children with disabilities. In Table 4, we want to know about what your final numbers were for the previous year for disability enrollment in relationship to your enrollment numbers. Next, Victor. Family services, everybody needs to have a family services curriculum now. We want to know the credentials of your family services staff in Table 5. Section G asks about your protocols for transitions. You know, it may be that you have something written out and you can just attach it. Section H, school readiness. Have there been changes to the child assessment system? I think in every case that'll be no. Have there been changes to the curriculum? For the most part, for everybody, that'll be no, unless you had added some additional curriculum to the creative curriculum. Have there been any changes to the use of the child-teacher interaction tool, the class? In most cases, that's going to be no, but you are going to need to let us know how you use class results to feed into teacher professional development plans. Progress on school readiness goals, Table 2, any changes? You know, make sure everybody should have copies of the school readiness goals that we have system-wide, right? However, just your agency should have particular school readiness goals or particular areas that you all have been focusing on. And so for those particular goals, highlight them in this table and provide us with some updates on it. Data trends, your agency's outcomes, and any adjustments to what you're doing should be included there, and information about how those outcomes are shared with the board and PC. Most of this should just be familiar based on stuff you do every day. Next. Okay, this section is new, Section K. Unless you, of course, did the Early Head Start Child Care Partnership application, we wanted to know a little bit more information about your partner, child care partner relations. There's a table about who your partners are, how long they've been your partners, et cetera. And number 2, we want to know about how your agency provides program services to partner site children and families. Every delegate, all of you, do it differently. And we would like to have it written down here, a couple paragraphs about how you divide, what's the division of labor between you and your child care partners. And then number 3, how do you monitor your partners? And then we want to know something about the fiscal and contractual relationship you have with your partners. And that question is more specific in the actual instructions about talking about how the reimbursement works and the like with them. Okay? All right. Attachment B, B3, the program schedule. Every year we talk about the program schedule, and every year it's an enigma that needs to be explored. So follow the detailed instructions in the grant application, and you can use the program options table to ensure services meet minimum levels. You should have one column for each program option and attach it separately to your email when you submit it as an Excel file. Make sure that program people fill this out, not finance people. Program people should fill this out. Obviously, program people should do the program narrative, but I think sometimes because it's an Excel file, the fiscal people end up filling it out and submitting it. And no, this is for program people. So we're going to look at it a little bit more closely now. Next slide, Victor. Here's the program options table. So this tells you what the minimum is based on the performance standards. Notice that there have been some changes. I guess this is something that Sam didn't mention, but as we move towards a comprehensive, cohesive system, we are moving towards a 7-hour full day across the system and a minimum standard of 180 days per year, all right? So it used to be our full day was 240 was the minimum. It's 180 now. That doesn't mean that you can't provide 240 or 200 or 220. What you provide should be based on what the children and families you serve need, right? And depending on what your other funding resources are, because some of them have different requirements. But We are moving towards that unified system of 180 days per year. And this is also in line with the feds are moving to a way of calculating duration based on a certain set of hours per year per child. What's the number, Victor? What's that number for the duration number for full day now? 1020. 1020 hours, 1,020 hours per child per year. Dosage. Thank you. Early Head Start remains full day, full year, and home-based hasn't changed either. So that's the same. Weekly home visits, hour and a half per home visit, bi-monthly socialization. So this is the program options table you can use to make sure that your classrooms and services are meeting the minimum standard. And next slide. And here's a friendly program options table. So the first thing you're going to do is, here you have your funded enrollment. How many children are in each of the options? Center-based, home-based, family child care home. There shouldn't be any combination options. Can you put your little pointer on that, Victor?
I can.
Great. So,
Want me to point or you want me to highlight?
I don't know. Right here. So this is where you're going to just the total number of center-based children, the total number of home-based children, the total number of family child care homes. All right. Then you're going to come down to section 2, right? And you might have, let's say that you have half day and full day. So your program option identification, CV, center-based, right? Funded enrollment. Let's say I have 2, so I'd have like 40 children there, or 36, or whatever it is, right? And then I would number of classes, groups, families, child care settings, 2 classrooms, not a double session, 7 hours a day, right? 5 days a week. Let's say it's 200 days per year, something over 180. 2 home visits, 1.5, right? So then I might have a second column with center-based, but this is my very small now home-based, or half-day program. So again, I would start up with up here, Victor, center-based. And then let's say I only have 17 children in it. I have 2 cohorts, right? Yes, it's a double session, right? And then number of classes, 3.5, hours, days, 5 days per year, 180 to 1.5. So I think the main thing to remember here is that you don't do a different column for each site, because you might have the same configuration at multiple sites. One column for the type of configuration, right? And then you complete the bottom portion if you're doing home-based. Family child care home, it's the same thing. You just put FCHH up here. I'm pointing to the screen, and there's nobody watching. All right. All right, next slide. Oh, put your name on this, please, where it says agency name. Put your name there. Put your agency's name and hit Early Head Start or Head Start. You don't have to do the PIR. That's fine. Okay. The action plan. So you should all have copies of the action plan. They were supposed to be, they were discussed and developed at your roundtable meeting. They've been finalized with your CSD program monitoring teams. They should be finalized with the leads of those teams. It should align with your goals and objectives in your program narrative and in the table, the program narrative tables. It should be approved by your board and your policy committee with your fiscal year 18 grant application. And in the documentation surrounding the board and policy committee approvals, there's reference to the action plan and the self-assessment. So next one, here's the template, right? So please submit this with your program narrative, your finalized action plan, okay? Next slide. All right. So attachment B, that's the program narrative. Please submit these documents by Friday, August 11th to the grant application email address there. If you have any questions about any of these documents, those B documents, the program narrative, the site allocation, the program schedule, if you want to talk through how to use the CNET tool again, please give me a call, all right, or email me and we'll set up a call. There's my email address. We'll set up a call to discuss. So then the program schedule or program narrative. You can also call Madeline. She'll probably refer you to me, but you can call her too. The action plan, you can call me about it, but also if you have questions about what should be in there, what was discussed in your roundtable, whatever, you should call your team lead, right? So that's either Rhonda, Denise, Elaine, or Sharita, right? So if there's questions about the action plan, the finalized action plan, please contact one of your monitoring team leads from the roundtable.
Okay.
Do we want to do any questions on that section before we move on to the attachments?
Sure, I can read some questions here.
Sure. Are there a lot?
Were you providing any guidance as to how to structure the community partner agreements, which are to be renewed effective September 1st?
So we are completing the self-assessment and action plan right now for the grantee. That's going to be shared with the self-assessment committee within the next week, and they're going to give us feedback, and then we'll distribute that to everyone. That's one of the things we're going to do this year. And you'll see that one of our action items is to develop a better framework and better guidance for everyone about what those partnerships should look like. I don't think that there's going to be anything in place yet for September 1. Victor, are you aware of anything different?
No.
But you know, I think that there are some recommendations in the instructions, but no, not yet.
Will this reduction in funding affect PFA or PI?
Okay, again, there is no reduction in funding. There's a reduction in the slot allocation, and no, it's totally separate from PFA and PI.
Is it possible to get a copy of the PowerPoint?
Yeah, well, we'll send that out via CSD updates, which means that whomever at your agency gets the CSD updates, you have to make sure that they give it to you. Unless you want one, if you want to contact Madeline directly, you can, and she'll send you one.
Should we receive the allocations for both Head Start and Early Head Start?
Yes. But Early Head Start doesn't require that sort of allocation by site form. It's only Head Start that you need to do the allocation by site.
Where can the updated program options table be found?
The updated program options table is in the grant instructions.
Are you also asking to separate the children by age group? No more 3 to 5 year olds in one classroom?
No, nothing like that has changed, I think. Whatever the guidance has been about, if it's more, I think, you should speak to your education person, but it's not changing. Your education person, your education contact.
descriptive question. We answered that one already.
Yeah.
What is combination
Don't worry about it.
option enrollment?
Doesn't, it's a vestigial thing.
So disregard.
From a previous era. Okay. Wait, sorry, Art, wait.
Are partners under center-based or?
If your partner is providing center-based services, they're a CB. Your family child care homes are also a partner relationship, but they provide services through family child care homes, in which case they are FCCH. So it depends on what your partner is doing. All right.
Okay, and now that brings us to the final section, which I'll go through very quickly because none of it's new. And it's attachments D through L as part of your your full grant application package. Again, to reiterate the due date, it's Wednesday, August 23rd, close of business. We need the original hard copy delivered here in person to me, Madeline Shea. And now I'll just quickly go through. So again, none of these are new. The instruction manual does provide a bit more context around how to properly complete them. So please take a look at that in closer detail. But for now, I'll just go through each one by one. So if you'll go to the next slide. Glenn already covered this one a little bit in the overview of the budget. This is the SF 424. This is found in your attachment A, your budget form, and it's attachment D is the version of it that needs to be printed out and signed only when your budget has been approved and finalized. That's the only copy we want signed and delivered over here. So if you'll go to the next, again, just make sure the whole form is completed, you know, the DUNS number is in there and all of that stuff, and please, again, make sure it's the final approved version before you print it out and have it signed by your board and policy committee chairs. The next attachment E, is a certification regarding level 2 of the executive schedule. That just says you don't pay people using federal funds whose salary exceeds the executive level 2 schedule, which I believe, Glenn, you can correct me, is $187,000. So this attachment E, Victor, if you'll just flip one more. This is located in Appendix 1, that one appendix that contains all the required attachments that are in Word version. So you can find that there. And again, it needs to be completed and signed by your board chair. Next one, attachment F, is the certification of filing and payment of federal taxes. Just means that you're on the up and up, basically, and that you've appropriately filed all your tax returns. Again, this is in Appendix 1, the required attachments document. It just needs to be printed out, completed, and signed by your board chair. And if you'll go to the next one. Yes, that's just guidance, again on attachment F. The next attachment G is the certification that your board and policy committees met, reviewed, and approved your fiscal year 2018 grant application. So you need to make sure that you copy. This is the reason why this whole Appendix 1 is in Word, so that you can copy this text and put it on your agency's letterhead. and be sure to complete all those highlighted prompts according to your program. And then make sure it's, again, signed by your policy committee chairperson and your board chair. And this, again, this is in attachment 1. So Victor, if you'll go to the next one, attachment H. So this is a very familiar looking form, I'm sure. This is the policy committee approval form that allows you to collect the signatures of the members of your policy committee that voted to approve your grant application. One thing we added at the top, please fill it out. If you'll see in red, it says insert your agency name, so please do that. But then also we need to be sure that we were documenting that your committee had met a quorum and that the number of signatures there reflects that, and what your total membership number is. So the number out of your total members. Just please fill that out, and then again, date when the signatures were collected and the approval was obtained. So if you'll go to the next slide. Again, this is attachment H. It can be found in that appendix 1. Please remember to fill out that information at the top about the quorum. Attachment I is not a form that we've provided. It's your minutes from your parent policy committee meeting that document discussion and approval of your fiscal year 18 grant application. So please make sure the minutes explicitly state that your policy committee discussed and reviewed and approved the fiscal year 2018 grant application. We need that explicit detail in there for HHS's review. The next one, please. And then again, very similar, but this one is to collect the signatures of your board of directors who voted to approve your grant application. Same deal with the quorum information at the top. Please remember to fill that out. This attachment is located in Appendix 1 with all of those other Word documents. The next slide, please. So again, attachment J is the board approval form. Attachment K is your board meeting minutes that, again, document the discussion and approval explicitly of your fiscal year 2018 grant application. So hopefully that's pretty straightforward. What I'll do in the next slide is talk a little bit about how to get approval if you don't have an upcoming meeting, because I know we have a short turnaround. So if you'll go to the next one, please. So I understand that many delegate agencies actually have some language in their bylaws that allow them to obtain electronic approval of certain things in lieu of a regular meeting. But if not here, if not, you may need to call an emergency meeting. But if you do have some flexibility, some options are you can call a meeting of a smaller subcommittee of your board, maybe the executive committee or a program committee. Just make sure that a quorum is secured for that group before anything's voted on. And please document that in minutes, and then make sure that you rectify this with your full board at the next meeting and document that in the minutes as well. If you're able, you can meet by conference call. Just make sure again that you have a quorum of your members so that you can properly vote. And then because this actually counts as a meeting, there need to be meeting minutes that accompany this conference call vote. So please keep that in mind. Lastly, there's the option of an electronic vote via email. And what you can do there is kind of begin a very descriptive email chain describing what's being voted on, the item, which is the fiscal year 2018 grant application materials. Make sure that the full package is included for review by the voting members. And then make sure that what you're collecting is a quorum representation of your policy committee or board. And then what we need is both for the conference call and the electronic vote, when you attachments, the attachments that collect the signatures, make sure that the names are typed in there, and then in the signature line indicate conference call or via email or something like that. But then, and then with the conference call, of course, we need the minutes. And then if it's an email, we need a printout copy of all of the emails that voted yes, just for, you know, documentation that it occurred. And then again, you may need to call an emergency meeting if none of these are an option. So just a little bit of additional information there. And then the last slide, please. Attachment L, if it's applicable to you, please attach your federally negotiated indirect cost rate agreement. There are additional pieces of information on what to do and if you don't have one, and that's listed in your instruction manual in 2 places, I believe, actually. And then I think that's pretty much it. So if you'll go to the final slide again, these are due in hard copy, originals in hard copy, no later than Wednesday, August 23rd, in person here at DFSS. So please set your meeting plans in motion now, you know, determine how you're going to get those votes and document them so that you can meet this August 23rd deadline. And then if you have any questions about any attachment D through L, you can reach out to me, which my contact information is there. And then just some concluding thoughts. Please, we've reiterated this quite a bit, read the grant application instructions carefully. Compile your questions as early as possible and ask them now if you can. And then use attachment 2 to make sure everything's complete and submitted according to the timeline. Attachment 2 is depicted there. And then that's pretty much it, unless there are any additional questions.
Funny you mentioned that. I don't know what this is. We'll come back to that one.
All right.
Who signs the attachment F?
That's a tax certification form. I believe that's the board chair or it's executive director.
All right, whoever's the authorized signatures, who's been the authorized signatures.
Good question.
I believe it indicates on the form.
That's the board chair.
Yeah.
Oh.
Okay.
Authorized certifying official.
Okay.
Okay.
Mm-hmm.
With the short turnaround time, is it all right to submit draft board
Yes.
and PPC minutes?
Yes.
I think we need Wanda, if you can do a clarification to your question. Then I think that's all.
Oh, she didn't hear the answer? Yeah. Linda didn't hear the answer.
To which question?
Was that the board chair one?
Yeah, the board chair.
Oh, the
The attachment F, who signs attachment F?
No. The board chair. Okay.
That's it.
Okay, and then the last slide just hammers home again the contact information. if you have questions regarding any of these various areas of the grant application process, you can direct them to the appropriate person.
Okay,
Not when we're on camera, Sean?
yeah, all right.
Thank you, everyone.
Thank you.